Okay, so what they're going to do when they scan is they're going to scan the upper and the lower models, scan the bite, scan the locator model with the fixed housing seated. They're going to design the locator just like a hybrid, just like a natural design, and they're going to design it so that there's wells for picking up the housings. We're going to add struts just like we did on that previous case. And then we're going to set up an online meeting for me to approve that final design. Okay. All right, so here again is the scan of the prototype locator fixed on the articulator. Then they're going to scan the lower model with, and I think what they did is I think they put just the regular housings on it in this instance. And then an individual scan of the prototype on the lower model. In this case, we had plenty of restorative space. We need 8 to 12 millimeters, like I said, for a locator fixed. And then they're going to design the prosthetic. So the blue again is the prototype, and the white is the shining through of the new design, enhanced with a little better anatomy, a little better tooth form, a little better contours. And they've also designed these struts so that we can seat the prosthetic on the model, just like we did the other time. Now, when I got this design back, there wasn't a lot of struts, and I felt that everything was so flat that I didn't really think that it would be as stable as I would. I was afraid it would slide a little bit. So I asked them to redesign it so that the struts could fit in like a little puzzle piece. And so what Sam did, and that's just how it was when it first came back. So what Sam did was he took a little acrylic and added these little pillars here. One here, one here, one here, and one here. And then he just took a little polishing burr and kind of made an indentation so it wasn't flat, it was rounded. So that when the zirconia prosthetic is fit onto that model, it would fit like a puzzle piece. It wouldn't slide from side to side. So here's the scan of these little pedestals that are going to hold that prosthetic in place. And this is how the struts will fit on those pedestals. And there's our final design. And now the prosthetic is milled out of zirconia material. And then just to make sure that they're not changing my vertical dimension and making sure the occlusion is, I asked them to first take in fact, I had them send the case back. I used my articulator. I put the prosthetic onto the master model, set the pin, and then sent that articulator back and said, don't move this pin. I want, when the final prosthesis comes back, I want it to come back at the same vertical dimension as what we delivered here. So we get our zirconia back. We're going to place undercuts in the model. We're going to sandblast the housings. We're going to make sure that the prosthetic fits the pedestals exactly. We're going to put it on the articulator, check the vertical, all the things that we saw in the previous case. Make sure that the pin holds shim stock. Make sure with shim stock we get multiple contacts on all of the posterior teeth. And then the technician is going to apply the coloration. And in this case, what they use when it's monolithic zirconium as opposed to PMMA, they're going to use a material called MEO. So this is a material that you apply and then you have to fire in the oven. And again, they have multiple different colors and layers to create depth and to create a natural looking pink color. So again, we have those struts that are still there. And you'll see what we do to get rid of those little white spots on the denture as we go along. So the pink is done. Just adding a little anatomy, a little contour. Finishing and polishing because we want a really nice smooth surface to the intaglio so that plaque does not stick. And now we're going to use those struts to pick up the processing housings. And because we couldn't pick up the processing housings earlier because this was going in the oven to fire that pink material. So pretty similar to what we did before. And in this case, we used a material from Kettenbach called Versatility. It's a dual cure material, and it's got bonding agents that work on both metal and on zirconia. So we're going to use the restorative primer to improve the retention on the attachments. And then we're going to use our Versatility, place it on the model, make sure that it bottoms out on those pedestals just like we did on that previous case. We're going to use our micro brushes to remove the cement. And then we're going to take off the little struts. And what that's going to do is leave little white spots, which we don't want to leave. So they're going to use another composite material to cover over those white spots. And they're in areas that aren't going to show aesthetically anyway. So, but you'll see that it comes out pretty good. Just getting rid of the struts, sandblasting it so the material sticks. And then they're going to use that Braident Creoline material that we talked about earlier. Put a little bonding agent, add the pink material. Here's our final prosthesis. And again, we're going to deliver the case with the black riders to the patient's mouth just to confirm the bite, the occlusion, the vertical dimension. And once everything is confirmed and the patient is happy, then we're going to place, again, on this case, 4 green housings. And we're going to use our seating tool to place it in the patient's mouth. And so here's our patient. That's with a screw retained upper and a locator fixed lower.